All right, welcome again. Thank you all so much for being here today. We are really excited to have you after a couple months off of this series. Looking forward to diving in, talking about quantitative research today. Ekaterina, you can go ahead and go to the next slide. So again, welcome back to our MEL learning series. The title for today's session is Making Numbers Count: How to Collect and Use Quantitative Data. So please go ahead and feel free to change your name to include your name and your organization's name, just like we have here on the screen. And then you can let us know in the chat or feel free to unmute and say it out loud what you're hoping to take away from the session today. So I'll give you a couple minutes for that, and at 7 minutes after the hour, we'll go ahead and kick off. Great. Welcome one more time. Thank you so much for being here. A couple housekeeping things before we really kick off. We're recording this session and we'll share a link to the recording after the session's over. We do have a dedicated time at the end for Q&A, but feel free to use the chat throughout the session or the raise hand feature to jump in with questions at any time. We do invite you to turn your camera on if you're able and comfortable. There will be some time at the end for breakout room discussions, and so we really encourage you to stay present and engaged and make the most of that time in small groups. And the last thing is at the very end, we're going to launch a short poll to get your feedback. We would love to know what's working or what's not working for you about this series so that we can make sure that the rest of the sessions are as helpful as possible. This is a quick overview of our agenda for today. First, we will talk about how we defined quantitative research and then move into some examples of quantitative designs and methods. We'll take a few minutes to focus in closer on survey research and then on classroom observations as examples of kinds of quantitative data that you could collect. After that, we'll talk a little bit about measuring learning outcomes. And finally, we'll end with a Q&A and the quick feedback survey that I mentioned. Thanks so much for sharing what you're hoping to get out of this session in the chat. We've got one more prompt for you. We'd love you to share 3 emojis in the chat describing how you feel right now about collecting and interpreting quantitative data. Everyone comes in with different background, different experiences, and so we'd love to know how you're feeling right now. Once you've put them in the chat, feel free to unmute and let us know why. While you're doing that, I'll just go ahead and read out some of some things that people are looking for today to kind of set the tone. To have information and new tools to improve quantitative data collection in your MEL system, to learn the importance of data in decision making, to learn newer approaches to data collection and analysis, keeping the lens of authenticity and ethics in data collection. Great. Anyone want to share the why behind their emojis? That's fine. We can go ahead and kick off. In the last session that we had in this series, we talked about generally quantitative and qualitative research and mixed methods, ways to combine both of those approaches. We talked about how the goal of qualitative research is depth. It usually occurs in natural settings. You'll usually find your participants with purposeful sampling, choosing the people who are most likely to have the information you're looking for. This often looks like interviews, focus group discussions, and data analysis is usually done with iterative interpretation. But today we're really focusing in on the quantitative side of this, where the goal is less about depth and more about breadth and testing hypotheses about specific questions. A lot of times this research can be experimental, quasi-experimental, or descriptive. The sampling is usually random. You're able to include a lot more people in quantitative research, and so you want to know if the people that you're getting information from are representative of the whole population. Data collection can look like surveys, assessments, administrative data, and a lot of times we're either interpreting descriptive statistics or doing statistical tests to understand what the data means. And one really important step when you're thinking about getting started with quantitative research is thinking about who are you wanting to learn about? Who is your population? So that's the target group, either for your intervention or for your research. So you'll want to think about who's using, delivering, or being affected by your solution, the kinds of subgroup differences that might matter, like gender, region, school type, disability status, or income. And you'll want to think about whether you're most interested in learning about your learners, about teachers, parents, school leaders, or some combination of those different groups. This is really important because when you're thinking about choosing your sample, so that's your population is everyone who meets the category that you're interested in, and the sample is the smaller group of those people that you're actually going to be collecting data from. So it's important to reflect on your population first to make sure that your sample is pulling from all of the different subgroups of people that you're interested in learning from. And I'll pass it over to you, Katrina.
Thank you, Sarah. Okay, so quantitative design methods, what are they made of? And let's drill down a little more to talk about more specific designs and how to use those designs, how to create those designs. So roughly speaking, we have two buckets. We have quasi-experimental or experimental and correlational. And remember, we started this journey of learning series, MEL learning series with a theory of change. So when we think about using these methods, typically we'll think about using quantitative methods in your outcome section. However, not saying that, most likely you would be interested to test using some quantitative data for your outputs or short-term outcomes, but it's most likely you're going to use a correlational data. So what's the difference? The quasi-experimental or experimental designs typically require the second group and making sure that you have before and after. And for some parts, you may have the balance of the groups. And in some cases, you even can have the control group. For correlational design, you don't require any of that. Sometimes you can have two groups, but you don't have to have a baseline and end line. And what you're really trying to establish with correlational is just the relationship, links between certain variables or certain aspects, how education mother's education connected to number of children. It doesn't mean that her education, number of children she has is causal, but in correlational design, it may help us to establish that there is some certain links. And after that, we can drill down further, exploring why did it happen that way, and either any particular reasons and really particular causations that have an impact on having a number of kids. which probably most likely not. However, through the experimental studies, we know that maternal level of education connected to children's level of education and their cognitive behavior. Okay, so that's roughly speaking two different buckets. And what tools do we use in order to, in those buckets, in those designs? There are a variety of tools you can use. There are surveys and questionnaires, there are documents, there are tests, and there are structured observations. So what's the difference? So you're all familiar with surveys. You either completed surveys one way or another or implemented surveys or questionnaires in your line of practice. They are very easy. They are very simple. They are fairly easy to implement on a wide scale. The people are open to tick the boxes, open to share their opinions in that way, and allow you to reach a lot of people typically. Does it give you depth? Not always. And it's typically very much dependent, your quality of data, very much dependent on how honest, how thorough, and how reflective were your participants. Sometimes there may be some level of self-reported bias. Documents are helpful, but documents exist with or without your research. So, for example, what do I mean by documents? It could be the attendance records, test scores, any admin data that exists without your design. Some of it might be very useful. Instead of collecting new data, you can use data that already exists, but because it wasn't created for the purposes of your question, it may not necessarily very closely align to your needs. There may be some gaps or inconsistencies, and also maybe not. Might be the case that there is too much data. You don't really need all of that admin data. So you would need to handpick particular aspects, particular variables that are relevant to your questions that you're trying to address and negotiate somehow to get that data. You don't have the ownership of that data with administrators or school leaders or any other owners of that data. But it's very cost effective. It may help because that data existed and there is a lot of it. It may really help you to observe the trends that you wouldn't be able to any other way. And also you don't really need to find different means of data collection. You don't need extra resources apart from getting agreement and principle from the decision makers. The structured observations helpful way to quantify the very rich data that happens on the ground, typically in classrooms, and that help you to define in numbers specific behaviors, condition, practices that otherwise might be very difficult to describe, especially if these teaching practices are related to your intervention or solution, then and you want to get evidence at scale and you want to find a causal relationship, that then quantifying certain behaviors or certain complex practices might be a nice way forward. So it helps you to actually capture the behavior. And typically we use observations to ensure the process, that process of your intervention, the fidelity is accurate and in place. It is time consuming. It very much depends on who is observing. So calibrating beforehand the observers and ensuring that training in place and certain practices are in place is absolute must. And of course, it requires some level of standardization before the observation or after the observation, if observation has been recorded. So let's drill down a little bit into surveys. We all use surveys. Surveys is a very, very handy tool that we can use in quantitative research. There are different types of surveys that you can use. It's a little deep cut, so just bear with me. There are descriptive and explanatory surveys. Descriptive surveys allow you generally to have an understanding of the landscape of your participants, of the demographics. That's very helpful for you to understand certain ways of practice potentially. However, explanatory allow you to answer the question why and drill down a little bit in causes. That's where we can talk about attitudes, measuring different types of behavior, elements of behavior or certain practices. So in the survey way, before we actually drill down in open-ended questions that collect qualitative data, explanatory survey can give us a flavor why certain things happening in that way. Census is the way, the survey way that when you collect data from everyone. Imagine you have an intervention for 10,000 kids and you want to know who they are and how much do they enjoy that intervention, how much do they participate. So census will cover all 10,000 kids. Sample, however, will allow you, sample approach to surveys will allow you to measure only group of them, and you can handpick and qualify certain criteria from whom you want to hear from each, let's say, intervention group. Cross-sectional allows us to collect data once and doesn't require multiple implementations. So it gives you a cut of information about your participants, whether it's teachers or students. It's just here and now, and that's a simple single cut. So that is non-reflective of multiple repetitions. Panel surveys allowing you to track the trends over the period of time. So it's longitudinal research. It's you implementing the same survey and you identify the certain patterns. You also can see how your participants has changed, how their attitude changed, how behavior, how their views are changing as they progressing through your intervention or engaging with your solution. Self-administered surveys are surveys that you hand to your participants and expect them to complete it without any guidance or any additional nurturing or support. The instructed ones that usually you have an ownership with and you are approximately holding their hand, figuratively speaking, and talk them through the questions, explain what do you mean by those questions, and you are effectively ticking the box as they respond to this survey. So within this survey, content-wise, there are factual questions. So that's the questions about demographics. They're helpful for us to understand who do we speak to, who is our respondent, and sometimes it might be very helpful for us to understand, use it as a filter question. So for example, do you use this intervention? Yes, no. If no, then skip next 5 questions. That's the filtering funnel structure. Knowledge questions are particularly focused on the awareness of respondent about something, whether it's about evaluation, about particular topic, about the elements of your intervention. You can also check the knowledge as a concept. So if you have a learning intervention, there are certain things you may test their knowledge on, and that could be the knowledge questions as well. Attitudinal questions are generally about the beliefs, opinions, values, feelings, and so on of your respondents. So generally, you're trying to understand how does your intervention, your solution, landing with them. Do they think it's a good one? Does it make them feel happy to be part of it? Are they proud to be part of that intervention? Are they believe that it's bringing them up through as they engage with it, or so on? Behavioral questions related to what people do or how the change is happening, and are generally related to the consequences of the intervention. So allow us to assess, explore behavioral trends. And then preference are about opinions and values, and allowing us to understand the opportunities out there. So preference questions allow us to understand how participants feel. So very, very much will have an emotional connotation in those questions. So when we design the survey, when you start to develop your survey, things you may want to avoid. And some of that is probably absolutely clear. Some of it maybe you have reflected less on. So try to avoid or think about how you phrase your questions. So perhaps you may want to avoid any sort of complex language, you may want to think about the abilities, language abilities of participants or your future respondents. Try to avoid any complex questions or complex terms. Avoid the ambiguity in your questions, as well as double negatives. We also don't, our data only is good as the respondents' answers and as good as our questions. Hence, we want to avoid double barrel questions. We're all really trying to minimize the surveys, and oftentimes we really don't want to give too many questions to participants because we know that they're not going to complete it. So we are really trying hard to put in the questions as much as possible information. But problem with double barrel questions is it's very tricky to say, are they answering the first half of your question or a second? So by minimizing the efforts, we undermine the quality of data. Try to, when you create design surveys, try to minimize bias or using leading or loaded questions. So using the statements that generally really difficult to disagree with is not going to be beneficial for you. That's not very meaningful because people want generally, in principle, want to be likable, and there is an element of social desirability. So using the hard to disagree statements is not going to give you anything very meaningful. And of course, when we're asking questions about, did you enjoy it? Did you like it? Did it work for you? Is minimizing the range of opportunities for participants to share their actual feelings, emotions, attitudes towards your solution. And of course, we have to bear in mind who our respondents are and ensure that questions we design would and the questions they will have in front of them would still make them feel good. So questions should be non-offensive. They shouldn't assume any language. So yes, we talk about complex terms, but we also want to understand that our participants may have different skills, different abilities, different level of knowledge and education. So assuming that they have certain knowledge or have too technical questions might be, again, give you very, very poor quality data. Try to avoid unwarranted assumptions. And as oftentimes we also want to get some very meaningful data, but remember about social desirability. So try to avoid the questions in which people will try to answer the way they think you want them to answer, as opposed to how they really feel or think. Okay, so I will do little group activity with you now. Let's please feel free to jump off mics or leave the comments. I hope I will be able to see your comments. Let's have a look at those 5 questions. I will read them out loud and reflect on what do we not like about this question. So question number 1, how many times have you personally failed to implement innovative teaching methods? Do we like this question? Do we not like this question? Please feel free to jump in. Let's discuss what particularly wrong with that question might be.
Yeah, I think thank you for the good message about quantitative research. I'm looking at this question and I'm feeling like it's kind of attacking the person, showing them where they are failing, instead of restructuring it. And probably it can be even divided into 2, like starting with showing maybe a strength that they have already done, and maybe now coming back to how attaching, like, is there a failure that or something that, because human, personally, when you come directly trying to show my weakness, I kind of get timid or feel shy or feel like intimidated, sort of, yeah.
For sure. Thank you so much, Patrick. I love your feedback. Totally agree with you. It's straight straight in your face about failure. We can ask that question in many different ways. But also the first part of the question, how many times? Is it really meaningful piece of information?
Yes. Can I
Go
go on?
ahead.
Yes. From my point of view, I think that there might be recency bias when we talk about how many times have you personally failed, because you cannot really count about how many. I'm putting myself in the place of a teacher, and I cannot really recall how many times I have failed because I did not track the number of times I failed. So there might be recency bias as when the survey is coming on.
Absolutely. 5 times. What does it mean for us? It's most likely that 5 times, 10 times, once. It's more likely we want to know why and what challenges they experience and what's behind that number rather than number on its own. Very rarely you would have a question in which you would need to know just yes or no or a specific number, unless you are checking your fidelity of your intervention, and then you would know how many numbers of lessons somebody attended or how many practices or pieces of homework or activities they done. That in that case it can be meaningful, but in this case it's very, very likely that it's very broad question that doesn't give us very much context as an answer. All right, is it not true that governments in low and middle income countries are uninterested in innovation?
Maybe Innocent here from Building Tomorrow. I think for
Innocent.
me, this one is it's a little confusing with is it not true? Is that, I don't know whether that's what they call double negatives, but something there is just confusing for one when you're reading. And then maybe some of the words are not fair to the reader, uninterested, could be replaced. Yeah.
Fantastic. Yeah, simpler the better. We have to, when we're creating these surveys, we have to remember 2 things. First of all, what kind of data we need. So what we're really trying to get out of those questions. And in any exploratory way, not in a leading way. It's not like we're looking for a good story. It's just that we're generally interested to know what's out there. But also we have to think about who our respondents are and is it clear enough for them, for sure. Thank you. Okay, question 3. Which aspect of education innovation in low and middle income countries did you enjoy the most? It's very broad. Thank you, Elena. That's exactly what I was thinking as well. It's so ambiguous. There is so many different elements and aspects of education innovation. Education innovation could be interpreted and defined in so many different ways. And leaving just generally low and middle income countries as such, the more specificity about context and region would be so much more helpful. And finally, about enjoy. There is such a loaded assumption that that individual who we asked that question about, they did enjoy it. Well, it is a question in the first place. And secondly, what does it really mean of enjoying an innovation? Okay, thank you. Is mobile learning effective for both improving literacy rates and closing the gender gap in education?
I think this one is double-barreled.
Fantastic. Thank you. Yes, that our data is good as the tools we're using, and if somebody's saying it is, we don't know what is. Is it for improving rates or is it improving, closing the gap? Okay, last question. Are you happy with how international donors are supporting innovation?
The answer is to evident, I think. It is like saying yes is the most obvious answer in this question. So it is not, no, there is nothing to learn apart from the answers of this survey.
Yep. Sounds fantastic. And also, yes or no question doesn't give us typically much context unless we use it as a funnel at the beginning, and then we are expanding further into specificity of that particular happiness if we want to explore something like that. Fantastic, amazing. Thank you so much for engaging and playing with this activity. And now we are moving on into the observation tools.
Great. So often in education programming, we want to know what is happening on the ground, whether we're working in classrooms or running education programs outside of classroom settings in the community or after school. It can be really helpful for us to know, is our program being delivered the way we intended for it to be delivered? And to do that, one thing that we can do is do classroom observations. Or if it's not a classroom, if it's in a community setting, the same thing, observing the instruction or the education program as it's happening. So there are some standardized tools that can be used for these kinds of observations. And then it's also possible to develop tools that are specifically for a particular innovation. So I'll give examples of both. The first one, this is from the World Bank. It's called Teach Primary. And this is a standardized tool that was developed with the intention that it could be used if you walk into any primary classroom anywhere in the world. You could sit down and use this observation tool to see what the teacher's doing and how they're doing it. So you can see it starts with a measure of time on task. So the observer would come in, and once they've been sitting there for 4 minutes, they're going to check, is the teacher providing a learning activity to most students, and are students on task? And then that happens again at the 9-minute and the 14-minute mark. And then the next section gets into classroom culture, questions about whether the learning environment is supportive, whether there are positive behavioral expectations. And what you can see here is that these are all very general questions or very general statements. So something like the teacher treats all students respectfully. It doesn't matter whether it's a math lesson, whether it's a literacy lesson, whether it's something that's being delivered to a first grader or an 8th grader. It doesn't matter if it's in a whole classroom setting or in a small group. That's something that you would be able to answer in all of those different settings. And so the benefit of using a standardized tool like this one, or there are other similar ones, is that once you have this data, you're able to compare it to data that other people have collected in other settings. So something like students being on task, you could compare how often students are on task in your program versus in other programs. So by using these more general statements, you're able to get that comparable data. Another benefit of using a tool like this is that if you're working in multiple settings, say different grades, or maybe you have some FLN programs, but you also have some high school programs, this is a tool that you would be able to use across the whole organization to get. So not only can you compare data with projects outside of your organization, it would also let you get comparable data across different age groups or different settings where you might work. And then you might be able to look at things like, are students more on task in our FLN program than they are in our high school program? Or are teachers setting clearer behavioral expectations in small groups versus in whole groups? The downside of using a standardized tool like this is that it's not going to have questions or statements that are really specific to your intervention. So say you're running a literacy program, and a really important part of it is that students should be reading sentences and paragraphs at the end of the lesson. Say there are, 10 activities throughout the lesson. The last one is that students are reading sentences and paragraphs, and you think that's really important for your literacy intervention. That if that's not happening, that's really gonna keep the intervention from working. A tool like this isn't going to be able to help you know that, because there's not going to be questions on here that are specific to the activities that the teachers or instructors that you're working with are supposed to do. So overall, the pro is that this is a very flexible tool, can be implemented almost anywhere. The con is that you might be missing some helpful information that's specific to your program. So then a different type of tool that can be used for classroom observations is a tool that's very specifically developed for the program that you're implementing. So this is an example from UFly Foundations, which is a foundational literacy program. And you can see here that instead of those more general things like whether the teacher's setting clear behavioral expectations, this is tied to really specific parts of the lesson plan. So here under step 1 for phonemic awareness, did the teacher provide phoneme blending practice? And how many words did they present? So you're able to check that off if they did it, to even write down how many words they used during that activity. Then if you look at the next step of the visual drill, again, these are very specific to the intervention. Teacher presented previously taught graphemes. How many did they present? So the benefit of something like this is that you're able to get a really clear view of how exactly is the program happening in the class. The activities that you wanted them to do, are those exact activities happening? Are students getting as many practice opportunities as you intended for them to? The drawback is that, of course, this is only going to be able to be used for that specific intervention. So if you're running multiple programs, you're not going to be able to compare data across those different programs with a tool like this. You also wouldn't be able to look at other programs by other organizations or in other contexts to see how is this comparing. So there are benefits and drawbacks of both of these kinds of tools. So we're going to give you a few minutes to look at these tools a little bit more in depth. I'm going to share the links in the chat for the Teach Primary tool from the World Bank. That's the general standardized one. And then the UFly Foundations tool that's really specific to the program. These are just screenshots on here, but I'm going to share the links to the full documents. And then we've got a few questions that you can think about and discuss in your group. So what do you think would work well if you used something like Teach Primary, and what might not work well? What might work well if you used a tool that was specifically designed for your intervention? And again, what might not work well? And then just spend a few minutes reflecting on which type of tool is a better fit for the work that you're doing and why. So we have a first, let me share the links, and you can go ahead and get those pulled up, and you can just take a few minutes to look through these tools. So the first link is for Teach Primary. The second link is for the UFly Foundations checklist. And next, I'm sharing a note-taking document. So once you get into your groups, you can use that. It has all the questions that were on the slides, and you can just type some quick notes into the boxes. And then when we come back all together, we can share, especially around that last question of which of these tools do you think might be most useful in your work. Can you give me a thumbs up if you're able to access those documents and the note-taking document? Great. I can see a few people on the document now. Perfect. Does anyone have any questions about what we're doing before we put you in breakout rooms? Okay, great. We can stay in the rooms for about 10 minutes, and after that, we'll bring you back here.
Hey, hi, Sarah. I'm struggling to log into the note-taking template. It's asking to log in from the Microsoft ID and all, so I'm not able to log into it.
Okay, let me see. Let me try.
I wonder if somebody else in the group able to access it, then it should be fine if as long as one person able to take notes, maybe.
Maybe we can, there are only 2 rooms, so I can maybe jump into one, and if someone else wants to jump in the other one, then
The second link is working. I'm able to access it now. Thank you.
okay, perfect.
Sorry, please send me again to the breakout room I had.
Yep, no problem. Oh, sorry, did it kick you back out, Innocent?
Yeah. I was wondering who sent me back.
Let's see. I'm trying to send you to room 2 now. See if that works.
I think Issa has been picked out as well.
Okay, I've added back to room 1.
I think there are 2 Issas. So there's an Issa in group 2. So I think he's joined twice.
Oh, okay.
Yeah. So maybe, yeah, you can send him to room 2, which is where the other
Okay.
devices.
Both Isas are now in room 2.
Yeah.
Welcome back. Thanks so much to group 1 for the great discussion. Looking forward to sharing back some of what we talked about. But maybe we can kick off with group 2. Does someone from group 2 want to highlight some of the key things you discussed? I can share my screen if it's helpful.
Yeah, sure, Sarah, thanks. I think what we were discussing is that surveys as the teach first one are very good in the sense that you have comparable data, that there's a benchmark there already, and it helps you to know if the intervention is working, and also quite crucially, you don't have to do that much of the work, like it's already done, you just have to use it. But the things that we will lose it would then be that it's not context specific and not that relevant to our program, perhaps. I gave the example of, for us, we deliver social emotional learning programs. So what we want to check is, for example, our books at the, or the list of activities that we tell them to do, are they doing them? Which is something like the Teach First we will not be able to track. So then for saying which one will be the best fit, there was 3 of us in the group, and Danielle and I thought probably our own, and Eric thought like still the Teach First, so the jury's still out. I guess whatever works for each organization.
Yeah, totally. Thanks for summarizing. And it's a great point. Something that came up when we were talking about that last question about what might be a better fit was that, yeah, two organizations are running a very specific program where they do want that data about is our program happening? Are our materials there? But the third program is more about general support for public schools. So in that case, you're not looking for them to be doing a certain list of activities. You're wanting to know on a more general level what's happening in the classroom. So depending on what you're doing, one or the other might make more sense for you. Yeah, thanks, Elena. Does someone from the other group want to highlight some of the things you discussed? Otherwise, I can just read some of the notes. So a benefit of something like Teach Primary, this is really similar to what our group talked about too. It's easy to put together since it's already been developed. It covers multiple aspects of teaching practice and can give you quick insight into the quality of what's happening in the classroom. Yep, ensures comparability, it's standardized, and gives you something broader than just understanding whether a specific program is being rolled out. And yeah, but it's not specific to certain programs. And similarly, a tool like the UFly Foundations one checks the capability of teacher to teach the specific concepts to students. Yeah, so you're able to get at those really specific concepts, not just general things. And yeah, specific teacher actions in relation to student actions. That's a really great point. You can get really granular with it if you're creating something on your own. It needs specialization and a level of training to fill it out. Right, you would have to know exactly what the program is supposed to look like to be able to know if people are doing it. And you might not know if this has been tested by a bunch of people to know if the wording's clear and if people who are watching the lesson have time to fill it in. Great. Those are all such great points. And it's always interesting to hear about everyone's own backgrounds and what's working in their programs already. So thanks so much for your engagement there. Next, we're going to talk about a little bit about some correlational quantitative methods. So these are ways to help understand the relationship between your intervention and some outcome that you care about, whether it's an adult level outcome or a child level outcome, even though these methods don't really give you enough evidence to say we caused this change. But they can be easier to implement and to use in your ongoing progress monitoring, which can be helpful as you're maybe looking toward a future impact evaluation. This is something that you can do now to understand if your program is associated with those improved outcomes. So the easiest way to do this is with a pre-post test. So you look at the average score of maybe it's a tool like Teach Primary, the number of points that a teacher got on that before they started your program versus after they've been participating in your program for 6 months. Same with a child level outcome. You could give a reading assessment before and after. So here you don't need to go out and look for a control group. This is just about monitoring the progress of people you're already working with, which makes it simple and affordable to implement and something that you can incorporate in your general monitoring. This can be a little bit stronger if you have maybe previous monitoring data or previous impact evaluations to refer back to say, we didn't have a control group for this study, but children in our program increased by this number of points, and we saw in a similar program in a different place that they increased by a smaller amount or by a larger amount. So you can still try to contextualize it if you have some kind of national data or previous monitoring data, but you're not able to say, here's a group that didn't participate in our program, here's a group that did, and we can show that our program caused one group to improve by more. Another kind of correlational design is a two-group design. So this means that you have a control group and your experimental group, but you only have one data point. So this would be kind of like an end line without a baseline or a midline point. So you just go into a setting, you do the assessment or the observation, and you compare people who are participating in our program have this score on average, people who aren't participating have this score on average. The problem here is that, one, you're having to find people who aren't participating in your program to be able to do this. And two, you don't know if those groups were similar before the intervention started. So between these two, the pre-post assessments are probably what's more likely to work for more organizations in terms of incorporating quantitative data collection into your general monitoring. And I'll pass it to Katrina for the next part.
Thank you. Okay, so causal data, let's drill down. So Sarah just presented a two-group design. That's fantastic. It could be very helpful and very easy to implement. But if you add the baseline, so we know where the participants of your intervention has started, if we have some middle points, and if we have the end line then and the control group, then we have a fairly robust design. We're not talking about random assignment into these groups yet, and we're just talking about the comparison, but comparison between two groups where we have the group with intervention and no intervention. So for understanding general traits or improvement for the intervention is very helpful, and it's certainly stronger than pre and post or two-group comparison. However, just to notice that pre and post and two-group comparison, while they are fairly simple, may not necessarily demonstrate the causal relationship and define whether the changes is attributed to your intervention alone or specifically to a certain extent. They are very helpful tools, especially when you're at the beginning of your journey, especially when you are testing or exploring new horizons or with a new feature, or you want to pilot something. Then there is literally nothing wrong with those approaches. They give you a very good flavor in terms of direction you can explore. And whether you need more robust, more strong and more powerful design, like difference and differences or randomized control trial. The issues with difference and differences is that we do have two groups. We have intervention group, control group. We have multiple assessments and baseline, end line, all great. However, we didn't weigh the groups. And what do I mean by that is that they may not be equivalent. So we don't know who are participants in our control group and how are they different to participants who are in the intervention group. And are there any biases or any underlying conditions that particularly can cause the results that demonstrate the change from the baseline to the end line. So we potentially can, at the beginning, when we're planning difference and differences design, we can start to think about how do we balance groups, how we ensure that participants who are in our control group equal or comparable at least to our intervention group. So we can think about their age, certain demographic characteristics. We can think about their baseline scores. We can think about the context, region, locations, and so on. So we would know, we will be more confident that the groups are comparable. All right, randomized control trials, we all heard about them. Golden standards, they allow us to claim the causal change, measure the difference in between the groups, and attribute those differences to our intervention. So that's how we do assessing the correlations, highly soon after, came up from the health randomized controlled trial in health sector. In public health, randomized controlled trials are widely used and very common. And it's very clear when you have the intervention related to the certain medication trial where you have very strong conditions. Have a tablet or a pill and know that no exposure to the pill. You can control it very rigorously, and you can see the attribution to the study and to the pill, the improvements on the basis of the taking that pill. However, with the education, life is a little bit more complex. And within education interventions, it's a little bit trickier because there are so many additional factors that contributes to child's development or improvement in a certain aspect, whatever you're measuring it, that keep ensuring that you control for those could be quite tricky. Nevertheless, randomized controlled trial allow a strong validity and certainly increasing the confidence that the differences that occurred is due to the intervention. A/B testing. A/B testing could be used for understanding the change or could be used in understanding of the experience. We don't have the control group typically for the A/B testing. You typically for A/B testing randomly assign your participants, intervention recipients, to 2 or more conditions and assessing either their experience, if you apply A/B testing in your output stage, or change. And for that, you may explore different conditions. So A/B testing is very helpful for understanding differences maybe in cost, different delivery methods, different reflection on the outcomes, or both. And what do I mean by that? I mean that you typically A/B testing be used in EdTech world, and the example of A/B testing could be that you have a standard pen and paper delivery, you know that it works already, but you are interested to explore new horizons and move your intervention to the digital means, and you're assessing if the digital means are effective as well as the pen and paper standard approach. So you're comparing 2 conditions. Sometimes you can have more conditions than 2. It doesn't really answer the question about improvement. It does answer the question about the differences between groups at different conditions. Still very helpful and much faster than randomized controlled trial, as participants are still randomly assigned, but you don't need to have a control group. And problems with having a control group that people are often enough begrudgingly taking part in research or assessments. And when they receive an intervention, at least it makes sense for them. But when they don't receive the intervention, the dropout rates could be higher, the motivation could be lower. So for the A/B testing, we don't have the group without the intervention. Every participant receives something, one type of intervention or another in terms of the delivery. So generally retention and the happiness and engagement of participants in that kind of design is typically higher. Okay, so it's time for another quick activity, another maybe 10-minute activity in maybe 7-minute activity. And I would love you to share your experiences of implementing different research designs. Maybe not all, pick one that you find the most interesting, the most challenging, the most memorable, and reflect on what worked for your context, what really didn't work, and what challenges did you face as you were implementing it, and maybe share one tip or word of wisdom in your group related to that specific method. Please share the experiences with one another. I think it will be a wonderful opportunity to share knowledge and share their experiences. And we are very keen to hear all those experiences or words of wisdom when you get back.
Great. I'll send you to the breakout rooms now. The questions are in the same document from before, and I'll also drop them in the chat. Hi, everyone. Welcome back. Hope you had some interesting conversations. Maybe we can start. Does someone from, I'm not sure if the numbers show up. So does someone from Pamela's group want to share what you talked about? Yeah, it was super fast.
I'm just wondering because only two of us shared. So if any other person who wanted to share in the small group and could not share, if any of you would like to share.
Maybe just like to say, in our case, where I work at Building Tomorrow, we have done an RCT, and it was the first we had ever done for the TAL implementation in the country. So yeah, I think for us, what went well really was that it was necessary because we didn't have a base of evidence for the contextualization of TAL in Uganda, particularly, and a strong base of evidence like that. So it was worth it for us to get that first-hand experience. Now that we have it, we are now thinking, of course, moving on to other things, which we are looking forward to. Then maybe the disadvantage was that we really had to rely a lot on expertise from like university researchers. So we had to collaborate extensively with other people to show us around and make sure our study is robust. Maybe I would also say something about the diff in diff. It's one thing I have learned along the way about, and I think in our context where we're working with schools, it would be something that would be relatively easy to implement. We can we implement, let's say, maybe in 40 schools in a district, maybe 40 out of 100 in a district or a province. So maybe we can work with the 40 and then talk to the district authorities to let us collect some information from another 40, and we can have some sort of robust study. So I think it's one thing that is easy to implement without incurring the costs of an RCT, and we look forward to that.
And there was also some discussion around pre-post tests. Shrutika or someone from the group would like to share?
Yes, I can quickly share one learning that we've had from the pre-post test survey. So in the pre and post for us, the programs which are, say the scale is not as much and the interventions are more comprehensive with a set of children, with a set of schools. So over there, we are tracking learning, a journey of a child from grade 1 to grade 5. So in those kind of contexts, pre and post has been helpful, where we've been able to see, like the journey of those children. Meanwhile, in the larger like system transformation and scale program, it's been challenging because the context itself is so diverse, with each unit of, say, like the administration. So in those scenarios, it's been really difficult for us to like frame that causation that, like the growth or the dip is the result of this particular intervention. So that has been like one learning in terms of where the pre and post might work and where it might not.
Amazing examples. Thank you so much. Does anyone from the group with Eric, Elena, Danielle want to share what you talked about?
Yeah, hi. I don't know if, I see Eric unmuting himself. Please do go ahead.
Yeah, no, you go ahead, go ahead. That's fine, go ahead.
No, please, I already spoke earlier, so you go, Eric.
All right, so we discussed and in our discussion, we noted that depending on the intervention and engagement with schools, and actually what you are providing helps to you to identify the method that is best suited for your case. So we share that in some instances RCTs were used, and then also inbuilt even in the RCTs or as part of the intervention, pre and post tests are also used, and then in the specific case, one of the participants also shared that since their intervention it's more tailored within the school, they focus on the pre and post, and then the DID. Difference in difference, which is quite simple and easy to manage. But for those of us rolling out the RCT, we noted that it was quite expensive because you needed to depend on you need independent evaluators to be able to do that exercise, and relying on sometimes even the government also makes it also quite expensive because of the scale of the rollout of such RCTs. So these were some of the few things that we discussed. In case I have left anything out, please you can add up.
Thank you all so much for sharing. I know we're already at time, so I'm just going to go ahead and share the survey link. We would love to know what's working for you or what we could do better in these sessions. So let me just put that in the chat. And then meanwhile, so once you've responded to the survey, feel free to drop off, but we'll stay on for a few more minutes for the Q&A portion. So if you have any questions for us, just feel free to stay on, and then you can either put your questions in the chat or unmute, and we'll be happy to try to answer them. But you should have access to the survey now. So again, once you've filled it out, feel free to stay on it for some Q&A or drop off. But we're so glad you were here. We really appreciate your engagement and sharing your stories and your own experiences. We're looking forward to the next session in this series, which I believe is on October. Sorry, let me get the slide pulled up. It's actually not working for me. Katerina, are you able to share it? Great. So the next session is going to be on October 30th, and the title for that will be Unlocking Insights, How to Collect and Use Qualitative Data. So today we were focusing on quantitative data, and the next session will be qualitative data. We'll talk about things like interviews, focus group discussions, and then how you can analyze the data that you collect using those tools. So thanks again for being here today, and we hope to see you again on October 30th.
Thank you. Bye.
Thank you. Bye-bye.
Thank you, everyone.
Yes, I requested the link for invitation for the next session of the learning session. Can you please put it in the chat?
Yes, let me see how to get that link.
It's actually the very same registration link that you used for the previous session. So what I can just do is add you to that session. I think that's easier.
Okay, thanks. Thanks a lot.
Okay,
Thanks to all.
can you just send me your email address separately?
I'm putting it in the chat so it is so it can be easier.
Okay.